Planetary Health first, Mars next. It is an amazing day. I wish I could say I was so lucky that I have my brother or relative on. It's Charles Mann. We're not related yet, but maybe if we both compare our ancestry, me or 23andMe, there might be some connection. Who knows? But anyway, he is the founder and CSO at Accushield. He has a really super cool background. He's been in sales, healthcare sales for a while, but he is really designed and meant for what he does. It's in his blood, it's in his DNA. His father was in this industry for years. He was a visionary leading what was once, lobbied against by the big nursing homes because his father did start, more of a home-like environment, family-like, I guess it would be called a facility or home care environment. And today, he's going to talk to us a lot about some of the new efforts he's done at Accushield and is doing. Go ahead, Charles. Share with us just a little more what you're up to about yourself before we do some deep dive.
Sure. Yeah. Thanks for having me. Just a little bit about me. Just sort of grew up in the industry of senior living. In the late 80s, my father got this crazy idea that he wanted to provide a place for seniors to age in place that wasn't in a skilled nursing facility. And at that point in time, there really wasn't any options to do that. And so in 1988, he went and found a bank that would go along with this crazy idea and built a 25-unit senior living community in Atlanta, Georgia. At that point in time, it was the first freestanding assisted living community. And so to see my father really do something that no one had done in that state, there were some other areas. Bill Lasky was doing it in the Milwaukee area, and that's where my father learned a little bit about the industry. But seeing my dad, I can just sort of envision him at the kitchen table with his yellow eagle, thinking through all of the things that a senior would need. And at that point in time, it was true assisted living, which is a little different than today. It was true assisted, no medical care, actually no medical coming in from the outside either. And seeing him think through, well, how many people do I need in the kitchen, and how many CNAs do I need on the floor, and where does the word executive director come from? So if you're in the industry, you'll sort of understand that. And I got the pleasure of watching someone grow a business, which was my dad. And at that point in time, I didn't really know what it was, but thankful for that upbringing. He was also in home health and hospice and home care, so I got to see the third party element of that. And through the years, always knew that I wanted to get back into really the senior living industry. But spent 10 years at Johnson & Johnson on the medical device side. Had a great time there, incredible company. They gave me a shot right out of school to be a full line medical sales rep. And so spent 10 years there, and then transitioned into the family business, which is still around today with two communities called the Mann houses in Atlanta, Georgia, and Cumming, Georgia. Spent 2 years there, and that's really where the idea of Accushield spawned from, because as I was running communities, I really noticed that it was too easy to come and go, and there was really no process behind identifying the visitors, vendors, and third-party healthcare providers that were coming in and out of the communities. So through that, built Accushield with Alan Barnes, my business partner, and have grown it now to a healthy size. We're being utilized in about 7,000 communities across the country. So excited to continue to do what we're doing. And thanks for having me on the show, Michael.
Yeah, no, it's great to have you here. And I love that kind of giving us a backdrop about, your why, really, and just also how you've seen it throughout your life from multifacets. And I didn't realize how involved you are currently in the actual facilities still in operation.
Yeah, not super involved any longer, because it was there was just sort of an inflection point where it was taking away from one, right? It couldn't be all things to all people, so ended up bringing in an operator to manage those communities. So I don't do anything day to day.
Well, I know we're going to deep dive on, probably everyone's wondering, the hashtag Project Love Meter. We are
Yeah.
going to do a deep dive on that. But I just wanted, before we go into that, I wanted just, I think our audience is across the board. And of course, we're growing it every day. You know, we'd love to have millions of followers, right? Millions of whatever. Um, but we do have a lot of startups, a lot of founders, and I think it's so important, the founder story. And you rightfully have the power today to. I would love to have you share your story, like what it was like starting from one to where you are now. I mean, I don't know how many employees you have, but you're a full scale business, and it's been, I don't know how many years. It's been almost, it looks like over 10 plus years. Can you just tell us a little bit about that?
Yeah, definitely. Anyone who's started a business knows that you get this idea and you start to run with the idea, and then at some point in time, you have to make the decision. You're either going to go for it, or you're going to try and figure out another idea. And I had done that so many times. I had thought of an idea and got to that point of either trying to raise money or putting my own money in it, and either just said, you know what, not ready. But this one was different. And I think the difference here, and it's funny, I talked with my wife about this a lot, is you have to find, I'm a big believer, and it doesn't always work this way, but for me, you have to find someone who's as passionate about whatever you're trying to do as yourself, which is in many cases the hardest part. And so the stars aligned, and Alan Barnes, who's my business partner, we believed in safer senior living and in being creating and having impact on the lives of residents in senior living. And when we connected on that, and we had the idea of creating, really digitizing who's coming and going, and creating fail safes when someone maybe arrives that shouldn't be there, or identifying folks that when a home health provider arrives, we were lockstep in that. And I could have never done it alone. You have to have that person that stands with you, because it's going to get hard. It always does. I don't know of one founder that would say it was just easy. Maybe I'm sure there's some that are out there, but that was not me, and that was not many of the founder friends that I know. And so, just want to shout out to Alan Barnes, and he was bought and sold, and he was sold out on the mission just like me, and would have never been able to continue this business, start this business, and get through the growing pains of getting something off the ground and really finding that product market fit. So that answer your question?
Question. So much of VCs are always looking for those co-founders, because it's so hard on that journey and the give up chance. So it sounds like you and Alan were perfectly matched for that. So so you tell us a little bit about Accushield for those. I mean, most of us know what it is, but just give us a little quick rundown on your product, kind of what it is, if you could.
Sure. Yeah, I'll kind of date it back to my time spent as a medical sales rep for Johnson & Johnson, a subsidiary called Ethicon. And when I started that job, I would go in and out of hospitals and speak with doctors about whatever product I was selling. And about 3 or 4 years into it, hospitals began to realize the importance of knowing which vendors were in their facilities and in their operating rooms, which is where I was going. And so they instituted vendor credentialing. And so there were companies like VendorMade and RepTrax, and all of which have been bought and sold, and now the names have changed. But that's where the idea really came from. And at the time, I didn't really appreciate it, because it was a change in what I'd always done. And it didn't feel like I needed to go check in materials management. I felt like I should just be able to walk right into the operating room and go right in and stand right next to a patient on the table. Hospitals felt differently about that, which I get now. And so really took that concept And it, because that was embedded in sort of the way that I did things through the latter part of my medical device career, I sort of took that same idea and instituted it more into the senior living space. And when I say senior living, speaking of assisted living, memory care, CCRCs, life care type of environments, and providing this, this opportunity for them to identify who's coming and going. Because as I was sitting behind the desk as an executive director, I think the issue that hospitals had was very similar to the issues that senior living communities had, but I thought was a lot bigger in senior living. And when you think about other adjacent verticals that maybe have people that come and go and really have vulnerable populations, I think about elementary schools. Think about if you try and walk into an elementary school and go walk into a room where children are being taught. They're not going to appreciate that. They're not going to allow you. And if you try and bust in, they'll probably carry you out and zip tie you and throw you in the back of a squad car, right? Mm-hmm. And actually, senior living is as vulnerable mm-hmm. as those children, right? And so why is it an open door policy? Why can I just walk into a senior living community and no one say anything and go and visit as many residents as I want? It's a problem. And so because of that, and because I'm passionate about seniors and I'm passionate about senior safety, why not treat seniors the same way that we treat our children? Mm-hmm. And so that's where the idea, and that's where the problem, that's where it was right into that safety and security, knowing who's in the building, and how do we, as operators, right, senior living providers, how do we create that safer environment by helping operators know who's in the building? Mm-hmm. I think creating that enforced control and creating that identification process. And for the most part, if you don't have a digital process, you either don't do anything, mm-hmm. right? It's crazy to me. Or you use some sort of paper sign-in book where, you may have a resident name listed, you may have a service rendered, or they may not even sign in at all. And so we have a specific badging process and alerting process. You can use an ID when you sign in. There's a lot of different ways, facial recognition, if that's something that's of interest. So a lot of these things, just depending upon how the operator wants to manage that front entry check-in. But that's really what we put our stake in the ground, is that if you use Accushield, you are adding a layer of security to your community, because you finally know who's in the building if you use the product the right way. And so it's just a little story about the why behind Accushield and what the product does. And that product, again, it provides safer senior living by helping operators know who's in the building.
Yeah, it seems like any family member that spends that level of money on assisted living would want to know that they have Accushield. I mean, what you're saying, and you'll know one day, because I know you have a son, not yet going to school yet, but as my daughter, when I would never be able to get in, I have to show them my ID. There's actually a security guard at the desk. So kudos to you to finding what was just oblivious in senior living. So now you're in 7,000 communities, your product evolution, it looks like you're in different, going to different verticals. Can you tell us a little more about now your current evolution before we get into the big talk coming in about 2 minutes or 3, the Project Love Meter?
Yeah, we believe that our vertical is healthcare. In specific, senior living. Sort of secondary to that would be skilled nursing. We're also providing visitor management for hospitals in certain areas, behavioral health, surgery centers. So we do a lot of different verticals, but all up underneath the same healthcare umbrella. We made the decision that we were going to stay in healthcare, and we were going to go a mile deep versus a mile wide. And so that's what we're focused on from a vertical perspective, is really anything that houses residents or has patients in a physical setting. That's who we target.
Well, let's talk about Project Love Meter. I know we were talking earlier about you were listening to your data. Your company is a heavily data. You have with 7,000 communities, and probably, I don't know, on average from 20 to 350 residents, and maybe to who. And this is where, tell us how this evolved and what this project Love Meter is and what it means.
Yeah, so right now, Accushield across our communities is signing in around 14 million unique visitors per year. And some of the things that we're capturing, our data is capturing, is the residents that are living in communities that don't have visitors. So you can imagine, Accushield digitally signs in a family member, and that family member is going to see, as an example, a resident, Jane Smith. And they have family, they may have friends that come in to see Jane Smith weekly. Well, a lot of times, and I know this as an operator and someone who's run assisted living communities in the past, there's a certain number of residents that get no visitors. They have no family. They have no one that comes to see them. And so the community sort of picks up that slack and says, hey, you know what, you're part of our family, and we're gonna be here for you, which is great. But a lot of times still residents go unnoticed. And in many cases, an operator, if you're an executive director, one of the things that we did is we had an activities director, which activities directors are awesome. But that's one person. And sometimes it's difficult to get residents out of the room. They may not be able to self-ambulate. They may not want to leave the room, but they are interested in more one-on-one conversations. And so, Project Love Meter really surrounds around one thing. And that one data point is the residents that may no longer have a spouse, and their family may live in a different state, and they don't have social visits, and they may be socially disconnected. And so we start there with that data point of identifying, maybe it's 10%, maybe it's 20% of residents living in senior living communities that don't have visitors. And so we take that 20%, we speak with the director or the activities manager, and we start to identify and pull data points, based on their engagement within community. And when we find 1, 2, 3, 4, 5 residents that may be suffering from social disconnectedness, we leverage our platform of volunteers. And so right now, say in 2023, 1.4 million unique volunteers signed in at the Accushield kiosk. And so that's something that we're utilizing then to say, all right, well, there are these 5 residents as an example. Let's leverage our volunteers and send those volunteers into communities to have meaningful conversations. And so when I say meaningful, that's the trick here, is we don't just want to send a volunteer into a community because it's a warm body and it's someone that they can talk to. That's not bad, but it may not always work. And so what we're doing is we're taking those volunteers, we're providing a questionnaire for them, we're understanding their likes and their dislikes and where they're from and what they've done and the things in their life that might allow for a unique connection with a resident. So it might be someone that, works at Home Depot, they love woodworking, and they were in the Navy, and they like old cars, right? Well, you take that and you find a resident that likes the same thing, so that when that volunteer comes, they can say, hey, listen to this. I was working on, a 70 Chevelle, and I know that, do you like old cars? Do you like muscle cars? And then you can develop that conversation. And so we're leveraging that, and not just our volunteer network within the kiosk, but we're also reaching out to other groups that have volunteers that are interested in participating in the lives of residents. And so if there's anyone on this podcast that's interested in being a volunteer and investing in the forgotten, which are the seniors that don't have family and friends, we would love the opportunity to work with you and allow you to visit and provide that scheduling for you in communities. So that's really what Project Love Meter is, and there's a little bit more to it on the technology side. We've also leveraged a scheduling tool, something that we have brought onto our platform called Flex. And we're using that scheduling platform. We sort of created we're creating right now another way of using a scheduling app. And so a volunteer would have an app. They could see communities in the area where they can potentially, if they're interested in being matched, and then we'll help match them with those residents.
So this has been really part of the flywheel effect. You've gathered all this data, and you're on both sides. You have all this insight about the residents, and then you're able to. I guess the hardest. What do you do to simplify it on the volunteer side? You know, how have you found, keeping it simple to get enough information to make that match on that side?
Yeah, so it's a questionnaire that they fill out. It might take 10 minutes with likes and interests and those sort of things. There is a process that will need to take place of credentialing. So verifying a criminal background check, making sure that they have the proper requirements to be able to be a volunteer, which is really important. And to your point, streamlining that process. We don't want to make this too complicated where you get an hour in and you're like, all right, I don't have enough time to do this. We want to try and make that process really simple. And so sometimes we work with larger corporations, where we need a letter of attestation, right? That's been part of their hiring process, which we will certainly take. And so once we have that, then it's really about finding out about that person, right? And then also digging into the lives of residents and understanding a little bit about what they do. And what they like and what they're interested in to create that match. We're also going to be offering training because it's really important, especially in certain parts of assisted living as an example, to understand a little bit about dementia, and a little bit about Alzheimer's. We think that's important, and so that will be part of it as well as we stand this up. We're really just now in the pilot stage. We've identified 10 communities that we're currently working with, and our go live date is coming up here pretty soon. So we're going to really launch this thing nationally February 14th.
No pun intended.
So we're doing a big push there to really generate more volunteers and more community interest in our solution.
I'm hoping, and I imagine that you're doing an effort to reach out to your communities with the whether it be the corporations, the small business owners. It seems like such a great effort to energize a workforce around doing good. Have you found receptivity?
Yeah, definitely. We have talked to a number of different larger corporations. And the interesting thing is there are so many volunteers willing and not enough opportunities to serve. So at least that's our perception right now.
Wow.
There's hundreds and thousands and millions of volunteers that I think would do this and want to be a part of it. It's just a matter of figuring out what they can do and where they can do it. And so this is, we want to make it easy on volunteers and, in hopes that it's close proximity to their home. So they don't have to drive all the way across town. There's so many senior living communities and skilled nursing facilities in the area. And there's just residents that are living in there dying. They just want that personal connection with another person. And that has so many benefits to their clinical life. So that's what we're trying to do. And again, it all stems from that kiosk, right? We're using a kiosk to track and to identify those residents that don't have social visits. And this is a little kind of side fact. Across all of our 7,000 communities, what we found, and this is senior living and skilled nursing, is around 30% of residents have less than one social visit per month.
Mm.
That's eye-opening.
Say that again.
Right. Out of our 7,000 communities, we have identified that 30% of the residents living in a community or facility setting have less than one social visit per month.
Mm. Wow.
Right now, they get visited from home health or hospice or home care, but individuals coming into a community, identifying a certain resident and connecting with them one-on-one. So, wow.
Well, Charles, I
Oh,
hope when we publish this out, we do it through different channels, but then we do a newsletter. I'd love for you to put some more facts, links, resources, campaign. I think what I'm hearing is Project Love Meter is kind of like the Uberization for people to connect, and most people, I don't care at what age, we're finding just awful, just really disturbing data points with social media, with everyone being disconnected, isolated, whether you're being 17 or mid four, so I think the desire for meaningful, purposeful, real life connections. I would love for you, if you're able to at some point, because you're so data rich, you're probably going to find out there's a equal health benefit for those who are volunteering, if not more, just as much as those who are being, it's such a great, if you would, a product fit. And so I can only say that, I have a father who's 91. He's on hospice. He has dementia as well. And it's just about spending time. He's at a point where it really isn't anything much on the conversation points other than just seeing him, being with him, and taking him out in the car and getting him at the seat of the table. And it's that dignity and respect. And so I think the training that you offer is just immensely with dignity, but it's not that complicated. It's just show up and just be respectful and just listen.
yeah.
And then also, this is what this is also just a simple bio or profile. No one would know my dad was a doctor. No one would know he was in the Army. No one would know anything because he can't barely, it's really unfortunate. Yes, no, a few conversations and he can fake it good. But other than that, he can't share much. So I don't know. Anyway, I've only had one cup, but I'm super excited for this. So however I can help. Will you be in Virginia? Are you in Virginia, in the Virginia Beach area?
Yeah, so we are part of our pilot. We're going to be working with Bickford Senior Living, which is a premier.
In Suffolk?
Yes, there's one in Suffolk. So we're excited about that's going to be part of our, Bickford Senior Living they are one of the best providers of care, and they care. And that's why they want to do this, because they understand the value of volunteers and communities. And we sort of envision on the community side is we have all of these volunteers. It's almost like air traffic control into communities. One, making sure that we've fully credentialed them, that they're, the type of people that we want to have participate in the lives of seniors, but then it's matching them. And so they get it. They love the idea, and they have raised their hand to help us figure out how to do this and scale this quickly and effectively.
So I know you have a business. Accushield is for profit. Much of what you're doing, it's sounding like how are you balancing that as a CEO? Tell me about that.
Yeah, we're thinking about, it does. It sounds like a not-for-profit, but right now it is for profit. I think we're looking at maybe spinning that out, still being under the Accushield umbrella. Just looking at the legalities behind it, because we certainly, want to make sure that we're doing everything we can to be, to be above board in that. And this is a philanthropic play. But it will require, at this point, the community is paying for that.
Mhm.
So, maybe we look at another, opportunity for it to be a 501(c)(3) or something. But right now, that's not on the roadmap.
But really what it is it's you being an entrepreneur, you being a missional driven entrepreneur,
Yeah.
wanting to do stuff that really makes a difference and just not just scratching that itch, but really finding that data point and satisfying that need. I mean, it's like you got such a massive shared with the data points, and it's like you have the capabilities because you're utilizing, I guess you said Flex, which
Mhm.
is huge. You couldn't do this without that platform. And so I really, really am so excited that, and you're strategic, that's your title, CSO. So you've thought about this. That seems like how you are. But I'm really excited that you decided to go into what some people would say no. It's so I think it's very admirable, and I'm very excited, and I hope we can share more about this after this is posted about and be updated on this.
Absolutely. Yeah, no, this is one of the most excited I've been, to do something, because our mission has always been safer senior living, and this really allows us to proactively address resident health, which is something I've always wanted to do, and there was never a whole lot of ideas as to how to do that. The industry as well is sort of shifting right now to what's called value-based care. And so you've got a
Mhm.
lot of operators that are saying, yeah, we actually provide healthcare. And how are we creating a better clinical environment as well? And how are we proactively addressing resident health so that we're not just sick care, right? That we're saying,
Mhm.
hey, if we can make the lives of seniors better by providing more and better connections, then long term, they're less likely to fall. They're less likely to experience mental decline. And that's what we're looking to do here, is that be proactive and really address resident health from a sociability perspective.
And so from an ROI as a senior living community, the more days at the community is, just from an occupancy is huge. The ROI is huge, and the value that you play could really help them do that. So I imagine you're going to be gathering the data points before Project Love Meter, their health. I mean, that's a little going to be a little complicated, I guess, in your pilot, depending on how much you want to gather, but there could be some easy assessment, some baseline through, working with the med director or whatever with someone's basic health just on readmission days or whatever. Would you be doing some little easy data points on before and
Yeah,
after?
yeah, we've got to be able to track success. To your point,
Hmm.
I think the baseline would likely be UCLA 3, which is a questionnaire for residents to help identify those residents that are suffering from social disconnectedness, right? Isolation and depression.
Hmm.
And so using that as a baseline and going from there. And so that's a very easy questionnaire for a resident to answer. And then from there, periodically, retaking that assessment to see and to track and to monitor, in the hopes that that gets better through social connectedness and one-on-one meaningful conversation.
Well, I had no idea when you came on that we were really going to hit what Planetary Health First, Mars Next is all about. Really moving healthcare forward, the real deal. This isn't just about like revenue cycle management. Nothing against. I mean, that's very important to operators and whatnot and to practice. But the Project Love Meter, I had no idea we were going to be talking about this and all your work. We're at like our 5 minute mark where we're coming to the end. We got about 5 minutes. I really thank you for saying yes. Anything else that you would really want to shout out there, get out there to how to find you, what you're doing
Yeah.
while we're here?
So obviously, Accushield is the parent company, and this is a feature of what we do, and we utilize the kiosk to do it. I think hashtag Project Love Meter is all about making meaningful connections to residents using volunteers, right? And If you're interested and you're on this podcast, go to hashtag Project Love Meter, put that in the URL. It's projectlovemeter.com. You can register as a volunteer, and we'll connect with you in hopes to assign you based on, again, that questionnaire and make those meaningful matches. So we've got a whole team. What's been interesting is that, this is a sort of a company initiative. Our company has gotten behind it. We've got people that we have. TK King is sort of the leader here. He has a clinical background, and he is leading the charge for Project Love Meter. So we need volunteers. If you're a community operator and you're interested in leveraging more and better meaningful connections in your community, certainly reach out to us. We'd love to work with you if you're an existing customer or if you're a new prospect. So that's kind of how I leave it. But we're just excited about this initiative, and thanks, Michael, for bringing us on. And to talk about something that means a lot to us, and has the ability to impact a lot of lonely people.
Well, I want to sign up. I think it might sound a little odd, but if this is possible, of course, my background check, I wouldn't. I think I'm good there, and if not, I'd have to check the fraud detection, whether someone stole my identity. Now, I shouldn't be your CFO or your coder, but for a volunteer, I think I'd make the cut, and especially Bickford's a little further down the road than me. But would it be possible if I did sign up and then I actually bring my dad with me and we just drive? Like, could I drive? Like, would we be able to, as a volunteer, as long as, are you able to leave the community and just drive them for about an hour, like a little bit, or what?
Yeah, I think we'd have to get special approval, but that would be really up to the community. If you wanted to take a resident off campus, there'd be some additional things that would need to be done, but that would be a community decision.
Okay. Or even just bring my dad in just for whatever.
Probably easier. Yeah.
Okay. All right. Well, I don't want to think too much outside the box, but anyway, it's very compelling, and just you've convinced me. Like, I want to get involved. So
it's easy to do with this message. I mean, it's kind of one of those things. If you say no to it, you kind of wonder why.
All right. Well, you heard it.
Just I don't get it. So anyway, that's what we're doing, and we're excited that you're involved. So yeah, I would love to get you into a community. So
awesome.
Go to lovemeter.com and sign up to be a volunteer.
All right. Well, thank you so much, Charles, for coming on to for Planetary Health First, Mars Next. Until next time, friends, you've heard it live on Planetary Health First.